Hello viewers, welcome to a brand new video of IIMT Open House. So today we have with us Professor Mona Srivastava, who is currently working as a professor and ex-head of Department of Psychiatry at Institute of Medical Sciences, Banaras University. She has completed her MD in Psychiatry from National Institute of Mental Health and Neurosciences, Bangalore, India. Previously, she was appointed as assistant professor at AIIMS New Delhi and assistant professor at IIMS BHU. Her area of interest focuses on child psychiatry, mood disorder, and genetic basis of psychiatry disorder. Dr. Mona was received gold medals during MBBS Best Paper Award Journal Pharmacology Conference, Best Seminar in Physiology, and runners-up trophy in Anatomy Seminar. She is a life member of all the Psychiatry Association. She is an editorial board member at Addictive Psychiatry and a reviewer of Science Direct journals and Frontier of Psychiatry. Ma'am, it's a warm regard. Welcome to you to our YouTube channel, IIMT Open House. It's an absolute honor. It's an absolute honor and privilege to have you here. And I hope today I, as a faculty and our students, will learn a lot from you about mental health. Ma'am, welcome. Namaste.
Namaste, Dr. Arun, and thank you so much for giving me this opportunity to be amongst you all and your students. And if we can make a little bit of a difference as mental health professionals, because this mental health issues are really a smoldering, burning issue, which is rubbished under the carpet because of a lot of factors like stigma, lack of awareness, and general perception that mental health people who suffer from mental health issues are called as pagal, which we strongly object to. And these words we have been really working very hard as mental health professionals to get over these words and also to decrease the stigma. We try and spread a lot of awareness among people, among students especially, because students are the forebearers of tomorrow, and they should be aware of so many things which are related to mental health. Because students, we are also doing a project among the medical students regarding the stress. And stress is a universal phenomenon nowadays. This kind of a fast life, a lot of pressure on lack of a lot of support system, also the rampant use of addictive substances, all this sort of get together and become a pot boiler of stress amongst children. And children or students are someone whom we really focus a lot on, because they are our tomorrow and they have to be healthy physically, mentally, to be able to take this country forward and to also take us forward. So that is precisely the reason that I'm really glad that you all thought about this aspect, and I thank you for inviting me, and it is my pleasure to be amongst you all. Thank you.
Thank you, ma'am. Ma'am, as you said, stress management or students, this was the motivation behind writing this book.
See, the motivation behind writing at this book was, at that point in time, like the entire world was sort of haywire. We really didn't know what was happening, what was going on. And everyone, irrespective of their department, was posted in the COVID ward. And the COVID ward in the first wave, everybody was in the ICU with no family members, only the so-called corona warriors at the forefront. My residents, the other residents, they were so scared, and they were like, everyone thought by touching or breathing we would catch COVID. Since the entire scenario was not very clear, how it was like transmitted and what was the contagion type of history, everything we were all learning. And at that point in time, there was utter confusion. There was a lot of problems with understanding. Faculty, they were unable to give any support. There were students who were just disappearing from duty, and duty was so strictly adhered to that we had to issue a whip every time. At that point in time, we started getting so many queries, and we also started getting a lot of requests that why don't you come and see this one and that one. And then from the ward also, we started getting this person. There were 2 incidents where patients jumped from the ward, and they injured, and one person died also. So all these things sort of precipitated. My residents were also very stressed. They were so scared of going. We had to wear the PPE, and wearing the PPE is really very, very tiresome. At that point, it was so hot. We used to drip, and when we took out the PPE, we were literally drenched in like sweat. And when wearing the PPE, once you don the PPE, we could not drink water, we could not do anything until we sort of dosed the PPE. Only then we could do. And coming forth, then we had families also. And even in our families, there were so many comorbidities, like diabetes is very rampant. So we were all scared for our family members as well. So this all combined prompted us to sort of come up with a very ready reference where people would just turn the pages and come across certain helpful things, because we focused on introducing the chapter, plus we also focused on certain ready references to be helpful, like in children, in elderly, what could be the reasons to mitigate, what could be the factors on which one could work, so to get over these stressful factors, and what were the lifestyle choices that one could undertake to work around this. In the second by the time the second wave had occurred, the book was already there, and we realized that our faculty and our students gave us a feedback that it was really helpful, and we had put it on the Twitter handle of our university, and also we had shared on the social media platforms, and this was multiple sharing was done, and this was very helpful. So this was the feedback we got. So with this feedback, we realized that we could bring about some change in the life of people. And partly misunderstanding, a lot of stress, lack of awareness, lack of family and social support. Like our students were living in the hostel, there were a lot of stigma. The other students wouldn't touch them, wouldn't come near them. So they had to be given food in their rooms. They could not interact. And for say 2 weeks, all the students had to get posted. After that, they had to rest for 4 or 5 days. We were also having a resident crunch. There were a group of residents who were posted round the clock. So that was again overwork. So all these factors prompted us to come up with this small booklet.
Ma'am, as you said, everyone was suffering from that. Everyone was everyone was thinking what to do, how to do it, how to deal with this COVID situation. Ma'am, is there any
Yeah.
different COVID manifestation among the different age group? Like what was for the senior citizens, what was for your students, what was it for you? Was it there in different manifestation of COVID for different age groups?
Yes, exactly. Every age group and even gender showed different kind of manifestations. Like children, they were mostly worried about their studies, and
Right.
a lot of online study really suffered, took a back seat. I could see in my house also, my daughter was in the 12th standard, and no, 11th standard at that time, and all online teaching was so haphazard. By the time the second wave occurred, people were much more attuned and much more sort of, they were adept at doing the online teaching. Incidentally, we also did a perception of online teaching regarding students. We've done this study, which has also been published. So we found that students were very worried about what could they understand. Half the children were sleeping. Even our medical students, when we were taking classes, out of all of them who joined, we asked them to put on the video, and the common thing which we noted was the fan up on the ceiling. No student could we could see their faces, and if we would ask them the question, half the time they were missing. Obviously they had put it on and then disappeared, either sleeping or eating or whatever. So online teaching, and then children who were really confused, and especially those children whose parents suffered from COVID, they had maximum anxiety, depression. A lot of children started having irritability, and ADHD problem like hyperactivity, and some children went into an internalizing that they would stop talking. They were in their cocoon. They were very much sort of anxious and afraid. Among women, these symptoms were of overwork. They were overworked inside, outside both. The ones who were working had to tackle with things outside, plus they had to tackle with their work inside, because as we are all aware, any kind of a house help was not available, and that really took a lot of toll. And there were certain sections of society where domestic violence was very, very rampant. There were certain people who were out of their job. So these were the youngsters who were out of their job and who had to sit at home. So the human connect was missing. And when the human connect is missing, so many people lack that talking, stress busting, and some entertainment, social issues cropped up. All these things were there. Then elderly population, I think, was the worst hit, that they could not have any help. They did not have their children because the children were living apart, and most often than not, they suffered from medical problems where they could not get any advice because all online consultations were there, but half the elderly are not tech savvy. So most of the time technology was, over the time everybody learned, but when the first wave hit us, then most of the people whom we encountered were really a lot sort of amiss as to how to go about, how to book for an online consultation. Even we in BHU were doing an online consultation, teleconsultation, and there are guidelines for teleconsultation with the ICMR came up with. But by that time, sort of everything, we would sit with a phone, people would come, people would call us, and then we would ask them for a WhatsApp prescription. Then we would see, and then we would answer. You can imagine people used to call us thrice, 4, 5 times. And when the time got over, then so many of them said that we've been trying to get in touch for so long. So those things were there, and every section was affected differently, and even gender-wise differences were there. So we really encountered all that. And in fact, there are a couple of articles have been written, like children we've written online. Then there is women in pandemic, where working women in pandemic, right from the person who helps on the street to policemen to teachers to doctors. Everyone who was stepping out of the house was really scared. So those things were there, and the children were there, students of the higher education like medical and tech, IIT and management, everyone, different sections were affected. So, and then the worst hit were elderly. That is what I. And then this also gave rise to a lot of addiction. Staying at home, alcohol was freely available. You all know that alcohol was really, like, it was given a boost for the government to earn, but in the long run, it was, people were really addicted, and by addiction, a lot of violence also has started happening. And these are certain statistics which we came across. And in fact, we then migration happened. A lot of migrants, a lot of problems occurred with migrants who, we came across them. A lot of depression, a lot of scared because their job was gone. How would they manage their houses? And when they went to their houses, the village people who were staying there did not welcome them. They now thought that they had extra mouth to feed, because these people had never come and now they are suddenly on their head. And these things were there. Then quarantine, essential services like grocery, medicine, food, everything was sort of affected. And especially online ordering of medicine, there were a lot of spurious medicines which people got. So this was one problem that we came across: different age groups, different sections, and different genders.
Ma'am, as you said, what addiction and the usage of internet was increased during that COVID time. So how was that addiction or the usage of internet has affected different age groups?
See, at that point in time, internet was also the savior and was also the demon, both ways. The only thing was how to judiciously use it. Children were always on the phone. Half the time, parents did not know whether they were doing their classes or whether they were watching something else. The exam was being conducted by schools, and all the children would sort of interact with another device, and answers would be exchanged and then would be written. So even the teachers were aware of that, but they had to do the thing, so therefore they went ahead and did it. But having said that, internet in fact was the savior, because it saved at least one very important year for the students. It also helped in people reaching out, people doing a video call with their parents, with their children, with their other helps, and talking. At least that was the only thing which connected. But this was also misused quite a lot. We have seen a spurt of internet addiction during that time. People had a lot of continuous watching of internet, and there were cases which came to us, like they were colored by corona symptoms, COVID symptoms. Like, I would like to tell you about one student who had come. He had heard that taking everybody was taking vapor inhalation, भाप ले रहे थे सब लोग, तो vapor inhalation and warm water would kill this virus. So this gentleman would constantly take very high vapor, very like hot vapor inhalation, and so much so that this hot vapor inhalation started affecting his nostrils, and he had a profuse bleeding from the nostril, and he was brought to the emergency because of profuse bleeding. Those capillaries in his nose had burst, and he was bleeding excessively. Then we didn't know what was happening, and then when history was taken, then he complained about this, and we were called to sort of intervene, and we had to give him certain anxiolytics and certain antidepressants. And continuously he would want, until he took a vapor, he was so anxious that he thought every breath would take the COVID like virus inside his body, and he would suffer, and he would be affected. Then there was, because of the lockdown, there were children who could not reach home, who could not travel, so they were sort of trapped in their hostels. And being trapped in the hostel also took a toll on their mental health, and especially medical residents, all those who are doing MD and DPM, they were denied any leave. Now they could not take leave even if they were even if they were sick. Only sickness, if it was COVID positive, they had to produce the certificate. Only then they could be given leave. Otherwise, they had to work round the clock. So this was one thing that all the doctors suffered. They just could not take any time off. And this was something which was really hurting us. So that was the reason why mental health of doctors, professionals, medical professionals suffered maximally. In fact, we did a sort of a survey through Google Forms of medical personnel, and that is also published. We found that about 67 to 68% medical professionals, especially the ones who are posted as a front line, were having depression and anxiety. And so many people came to us, and we had to prescribe them certain medicines. Of course, by and by, when things normalized, we could stop it. There were some cases wherein some doctors were so scared to even come to the hospital, like looking at the hospital gate, they would start having this panic, like a PTSD kind of a phenomena. And so many professionals lost their parents, lost their other family members, which was also very disheartening.
I'm damn sure you have been dealing with most number of people during this COVID time. Many professionals has been dealing with COVID. So how was it? What was the impact of the lockdown on a single individual, or you can say a housewife, or a medical professional, or a doctor, or the students? How was what was the impact of the lockdown during that time?
I think all of us are aware that the lockdown was something which we really couldn't get over it. And the initial impact, people thought that we will sit at home and enjoy, which turned out into a nightmare. People couldn't get around. They had to really focus on getting their things. And then the biggest impact was nobody entering. And also, like in the first wave, there was the entire sort of the mohalla was cordoned off, people's houses were blocked. So it led to a lot of stigma. People would think and behave as if there is some kind of a scourge which has occurred and people shouldn't be touched, shouldn't be talked. And there were instances where doctors who were living outside were thrown out as their landlords did not want them to bring infection. So rather than joining hands and coming up with a solution, the entire society was really sort of, because of lack of knowledge, a lot of fear, everything was centered around just not focusing on people rather than focusing on illness. Like, this person has the illness, so the person should be shooed off. Nobody should come near their house, nobody should touch them. So by the lockdown and the quarantine, a lot of harm was done rather than any good. And this was realized in the second wave. So we had learned quite a bit after the first wave. And the second wave was, although there was a lot of infrastructural breakdown, but nevertheless understanding was a little better in the second wave. And third wave, subsequently, there was a lot of vaccine available, so people got over it.
Ma'am, as you have seen news, during the first wave, the second wave, third wave, many people were working in different places. Like in Odisha, our people used to go to Gujarat or Mumbai or Delhi for their well-being. So what was the impact of migration on the well-being of the individuals during that COVID time?
We had a sort of a shivir, or a sort of makeshift arrangement where these migrants could be housed, and they were housed, they were given bedding and food and all that, and a lot of people did charity, but that was not enough. We could see that migration was occurring for kilometers and kilometers. Like, people from Gujarat were walking down to Orissa. And you can imagine what would be the large scale displacement which was occurring, and with a lot of threat. They were not knowing whether the next meal will come from which place, whether they will be robbed or whether they could reach home safely. They were just not aware. At that point, people were also trying to make in a lot of sort of incentives, like the truck drivers and the bus drivers. They were all trying to take extra money for them to reach home. So all those people who had sold off everything, taken a little bit of money which they had stored along with it, with a lot of uncertainty. See, any kind of an uncertainty is the worst possible thing which can occur to human beings, because human beings by nature want to live in a sort of comfortable environment where they have a assurance of their next meal, shelter, family members. This kind of a, every being is always important. The assurance is important for all living beings, all the more for human beings. And this large scale displacement, not knowing where to, what will happen the next hour, the next day, the police and the entire machinery was trying to help, but there were also instances where a lot of stigma, a lot of discrimination and violence was also occurring. And this really took its toll. We had actually done a study on migrants in this particular camp, and a whole lot of them were weeping and crying, although it was we called it as an adjustment problem. But a significant chunk, say about 20 to 25%, were later on diagnosed as depression. A couple of them were diagnosed as PTSD. People who were already suffering from mental illness because of the lack of medicine, their illness exacerbated, and they couldn't come across any medicine. So we also did something as distributing certain medicines, but all this was a very like a drop in the ocean, whatever we could do. But nevertheless, we tried to do with a lot of NGOs, we tried to chip in and do our bit.
So, as health professionals, you have been working day and night during the COVID time, how to make life easier of the citizens. But how COVID was impact on, what was the impact of COVID on the community of doctors or the health professionals? What was the impact of COVID?
Actually, the doctors were worst hit. First and foremost, we were the ones who would go with the PP, our residents, students. The other older doctors like the HOD and all, they would sit with the in front of the computer and monitor all those patients who were we had a CCTV on every bed, did like that. And patients were also encouraged to talk, and this is how we asked the patients' family members. But surprisingly, a lot of family members didn't even bother to come and ask their relatives how they were doing because of the fear. And this was something which is very disheartening. We had so many people who would weep that we were the ones who took care of them, and now we are ambulated, and nobody is even bothered to talk to us, at least talk. So we requested their family members to reach out to at least give them some solace. Most of the time, the family members did not appear. Sometimes they came, and the ones who came were really helpful. So mental health of doctors was really affected. Doctors, to the tune of 67 to 78%, were suffering from anxiety. 53% were having depression, full blown depression, and about 23% were suffering from PTSD, that is post traumatic stress disorder. A couple of them who were, they say, about 5 to 10% who were already suffering from some illness had an exacerbation. A lot of addiction also happened. Somehow around 20 to 30% of our doctors resorted to addictive substances, and a lot of nicotine, alcohol, and in this part, like Varanasi, I stay, the cannabis intake is very rampant. So that was also there. And so depression, anxiety, PTSD, adjustment problems, addiction, all these were affecting the doctors to a larger extent than the general public.
Ma'am, as you said, it was an impact on health professionals as well as the individuals as well. So, how means the general health? We are having like a cough or a sneeze or something like the common cold. We call it as common cold, or certain like a headache or something. How you are dealing with these type of symptoms? Like people used to get scared. Like if I'm sneezing, oh, I might have a COVID. If I'm having a headache, I might have a COVID. So how we were dealing with all these symptoms of general health measures to the corona warriors or to the doctors or to the citizens? How you are dealing with them?
Actually, what was the norm was that after 2 weeks of posting, all the residents and all the doctors who were posted it was mandatory to undergo the COVID testing. Without the COVID testing, they would not be allowed to go to their normal hostel. There were quarantine services which were instituted. There were hostels which were given for class 3, 4 employees, for nurses, for doctors. Everybody had their stipulated place where they would stay during their course of posting. Say 2 weeks was the time for posting, and during this 2 weeks, they were apart from their houses. They would have to eat the food which was provided, they would be given certain rooms, and they would live there. After the COVID test was done, they were found to be negative. Only then they could go to their houses or hostels. This was happening in the first wave.
First
But
wave.
over the time, the government realized that it was a lot of drain on the exchequer. A lot of money was involved. Like food has to be given, everything was to be given, and that was leading to a lot of drain. So the government decided, then the policy changed. Like if you have done the duty, you undergo the COVID testing. If the COVID test is positive, the titer is good enough where you can be infective, you would be given a room in the hostel. Otherwise you could go to your own place where you were staying. So this was there. And This actually led to a lot of confusion later on, because people would have, because they were round the clock in the AC, and a lot of infection could occur, and normal cold and flu would scare. Like, one of my residents was having normal cold and flu. A young boy of 25 years is good enough, has a lot of immunity, so he shouldn't be scared. But he was so scared that he started having a breathing problem. And when he started having breathing problem, everybody thought that he is having a severe COVID. His blood oxygen level dipped, and so he was shifted from the normal ward, to the ICU. In the ICU, people were dying. Like, the people next to him, one day they expired, the other person next to him, they expired. So a lot of deaths were occurring, and that was so scaring for him that he became very anxious. And then we tried to give him certain medicine, and when in anxiety, he started hyperventilating, like taking deep breaths, and that led to his blood oxygen level going down further. And the doctors decided to intubate him. That is when we chipped in and we said, nee, we will give you anxiolytic, and just take some, try and bear and change your perspective. So he started doing deep breathing, supine positioning, and the anxiolytic worked, and within 2 days his blood oxygen was also normal. So the first thing we did is shifted him from the ICU again to the ward. So ICU was a very traumatic experience, because people around you were dying, and the death rate was pretty high. And you can imagine a person lying down, and the person next to him, her, dies, and then another person dies. Every day there are 1 or 2 deaths, and people are just being packaged and sent, and you are sitting there witnessing everything. So it can be a very traumatic experience. Therefore, the doctors were really hit very badly. And to this date, there are a small chunk of doctors who are really affected, and still they have sort of post-traumatic stress disorder. They don't want to remember, they are unable to work. Every time they have those nightmares, and they also don't want to go near the ICU or the COVID ward which was made, because every time they go near it, they have this anxiety and palpitation, severe anxiety. So that took a toll. But yes, over the time, everybody is sort of healing and coming out of it.
Means certainly you are saying that slowly people are coming out of this COVID norm, and they are going towards the normalization of the life.
Yes, precisely. Also, vaccine helped. Vaccine which
obviously.
came, that gave a lot of hope. So it also helped people.
Thank you so much, ma'am. So know your perspective about the book, how you have written, how you have addressed this issue of mental health. It was great knowing that how you have dealt with so many patients about this mental health, about the COVID. It was very much nice talking to you, ma'am, and thank you so much for sharing your experience in our YouTube channel. Thank you, ma'am.
Thank you, Dr. Arun, and thank you to your institute for coming up with this novel idea. I think these kind of activities really help in promoting awareness about mental health, and that becomes very helpful for general public, students, and others. Thank you for the initiative, and thank you so much for inviting me.
Thank you, ma'am. Thank you so much. Have a nice evening. Thank you, ma'am.
Thank you. Okay.
Namaste.
Namaste.